In addition, we'll be sharing the presentation materials after the webinar, and you can download them directly on the final closing screen in the file pod, which is in the lower left-hand corner of that screen. In order to ensure everyone can hear the presenters and avoid any technical difficulties, please mute your phone by pressing star and then pound, or selecting the mute feature on your desk phone or mobile device. I'm also going to be muting everyone but our presenters. Finally, if you have questions and comments, you can type them in the Q&A pod found in the lower left-hand corner during the presentations. Once the presentations are complete, David will field your questions. If we aren't able to get to your question due to the time constraints, know that we will get to those, we'll get them answered and share them to the larger group afterwards. Thanks again for joining us, and I'm going to hand this over now to David to introduce our presenters.
Thank you, Kathy.
You're up for a second, Kathleen. I've gotten a goofy screen on my iPad here. Oh, there we go. Never mind.
Hey, good afternoon, everybody, and welcome to our final community practice of 2015. Just as a quick historical capsule, if you remember, this will be our 8th community of practice call here in Iowa, and we started back in February talking about person-centered planning, and then we did a webinar on mental health employment best practices, and then we had a session on parent engagement in individualizing employment outcomes. And we had a couple of sessions talking about our transition from pre-vocational services to community integrated services. And that led to a couple of sessions on school-to-work transition practices. And we're very excited about the panel of presenters today. I'm also happy to announce that our Iowa Community of Practice calls for 2016 will continue. We're working on identifying a schedule and an agenda. So please, in the comment section today at the end, when you have a chance to fill out the satisfaction surveys, please take some liberties in giving us ideas of topics that you want addressed in these community practice calls for 2016. And we'll do our best to identify good presenters to meet that need. For our presenters today, I will take a second here and do a little introduction of all of our presenters, and then we'll be able to transition to each of them individually. But we have Bill Stumpf. Bill is from the Dubuque area, and he and his son Kyle have been excellent advocates as we look at employment services in Iowa. Bill has been part of our Parent and Family Coalition, and also has participated in our Developmental Disabilities Council. Kyle has began employment and is beginning his employment journey. So Bill is here to talk a little bit about his journey as a parent through the integrated competitive employment process. And I think we'll add some perspectives that will be important to challenge us. After Bill, we'll go to Northwest Iowa to hear from David Van Ningen. David's the Chief Executive Officer of Hope Haven in Rock Valley, and is not only known in Iowa but across the country and internationally for the work that's occurring through Hope Haven, and they've really made a positive difference in the lives of so many. Hope Haven has been one of our strong community providers that have been involved with community integrated employment from the get-go, and has been working on system design and change through the Iowa Coalition of Integrated Employment. David will share a little bit about the work that Hope Haven's doing with regional partners and what that looks like in their region through partnership and how it's impacted them. And then we'll go with Shannon Jamison. Shannon is the program director with Goodwill of the Heartland in Cedar Rapids, and has been a longtime participant in our community of practice calls, and has worked in with Goodwill as part of the Integrated Employment Leadership Series that the Iowa Coalition has put together. In that, we've had 34 leaders that represented 21 different agencies across Iowa. So Shannon will share a little bit about Goodwill's experience with that and how it's impacted them and some of the changes that they're working forward to build for the future. We're also very pleased today to have Representative David Heaton with us. Representative Heaton will be listening in on the conversation, and I'll have a chance to share some comments at the end. But Representative Heaton has been a key advocate for all of us in the human services and employment arena. He's served in the House since 1994 and comes with us from a public education background as a school teacher, and he and his wife have been entrepreneurs, and he's also been a member of the United States Army Reserve. And on behalf of all of our professionals, we've really appreciated Representative Heaton's tireless work behind the scenes to create positive change. And to do a little more formal introduction of Representative Heaton, we've asked Sue Ann Morrow to share a few comments. And Sue Ann has been on our Employment First leadership team and has been really the strongest person to keep us moving forward for many years in Iowa. And we've really appreciated her leadership. And she's part of the Southeast Iowa area that works with Representative Heaton. So I'm going to have Sue Ann also share a few comments.
Yes, I was really excited when Dave asked if I would introduce Representative Heaton. Because everyone's from across the state to hear how his advocacy work has made a difference in the lives of people with disabilities, their families, and providers. As Dave said, he served in the House of Representatives for over 30 years, serving Lee, Henry, and parts of Washington and Jefferson County. He's seen many changes during that time, but one thing that has not changed is his advocacy on behalf of Iowans. He's been a champion for us and the professionals as well as families for many years. Representative Heaton serves on the Appropriations Committee, the Human Resources Committee, the Judicial Committee, and serves as chairman of the Health and Human Services Budget Committee. After we hear from other guests, we'll ask Representative Heaton to share a few comments with us.
Thank you, Sue Ann. And again, we're very pleased to have all of our guests here today, and we'll hear from Representative, but we're going to turn it over to Bill. And Bill, thank you for joining us, and we appreciate all of your efforts, and we'll look forward to hearing your comments. So, Bill, the floor is yours.
Okay, thank you all very much. And can everybody hear me okay? Because I have my phone on speakerphone, but I can put it up to my ear if that would work better.
You're coming in loud and clear.
Awesome. Okay, so I'm assuming y'all can see the slides. First off, I do want to send out a good shout out to Ashley Lance, who helped me put this PowerPoint together, because I'm a little bit, not real good with technology. So I provided her with a few photos that was easy to do, and she put the rest together, and I think she did a fantastic job. So thanks a lot, Ashley. The man behind the pizza, and I love it that we named it this, because it'll fit in some of the other slides, and it's a parent's perspective on transformation, and it truly has been, not only for Kyle. We went through this journey together, but for myself as well, especially in terms of maybe my getting stuck in one certain spot with respect to what his abilities were and what he would be able to accomplish. So I think that'll all speak to itself as we go through the slides. The first slide, Kyle was born in 1990, and I have to say it's a cute baby picture. It was, but there's even a little story behind that. When Kyle was born, he was one of those, what they used to call tech babies. He had a trach, he had a G-tube, he had an ileostomy, so, I mean, he was a premature. So the fact that he had Down syndrome really got kind of put on the back burner, and we were really focusing on a lot of medical issues. His first year, he spent quite a bit of it in the hospital, which I think also helps to make his story even more remarkable. The summer that after Kyle was born, he was born in February, the Americans with Disabilities Act was signed into law. And all I could think as a new parent of a son with a disability was, wow, this is awesome that we now have, it just seemed to fit. I thought, okay, so he's always going to be protected. Then expectations versus reality as a parent really kind of came into play, because I found that even though we had a law that would protect folks with disabilities, it didn't always happen unless people stood up and said, okay, let's make this happen. And I think to an extent that continues today. I think it's gotten better, but laws are only as good as is how they're enacted, and that usually comes down to the grassroots level, and we want to make sure that they happen. High school, we jump quite a bit forward here. Kyle's high school experience, I had always pushed for Kyle to be included in school, and I think he was better, but some years were better than others. Sometimes, you know, it was more of a matter of just giving him a seat, you know, to satisfy what we felt was best for him, and I don't know that he was truly included even in the regular classroom. And by high school, you kind of get tired of fighting, and so I kind of just let things go. His high school experience was pretty good. You know, I did like his teachers. They did go out in the community, although what I found his community involvement to be were groups. They would take him out and they'd clean restaurants and things like that, which was fine, and he did obtain some skills there, but I thought, well, maybe there's something more. And I know that one of the things they would do is go out shopping with the students, and what I found there was they were taking them shopping, but they would put all the items back at the end of the shopping trip, and I thought, well, that's not real. So with our in-home program through the waiver, we started to do real shopping with him, so that kind of moved that in a different direction. At the end of his high school years, we started talking about, you know, what would be after high school. Again, at that point, as a parent, I was pretty worn out and just kind of went with everything. I don't know that we even really talked to vocational rehab at that point in time. It just looked like a pre-voc setting was going to be the best for Kyle, so I looked at a couple of those settings and settled in on Goodwill, and the experience there, and I want to point out, has been very good. It's really moved Kyle in a good direction to learn some skills and gain a lot of independence too. I went to work with him one day, and as you see on the slide, so did Senator Yoakum. We participated in Take Your Legislator to Work Day, and found that I think it was an eye-opener for her as well. It was an eye-opener for myself, because I hadn't realized all the skills that Kyle had been able to obtain. So I started thinking, well, maybe there is something more, but where do you go? Around a few years back, and Sue Ann will remember, I think she was one of the first people I met with on the DD Council, and she'll remember what my early years were like there. And got involved there and started to hear more about integrated employment options, and honestly, it did not happen overnight, and I think Sue would attest to that as well. I love the quote that we added in here, that there is no greater disability in society than the inability to see a person as more. And I don't point just to society to that. I'll point to myself as a parent for that too. And I was having a little difficulty seeing, you know, that there could be something more than pre-voc for Kyle, and it seemed to be working pretty good. So I thought, well, why do anything different? In the fall of 2013, I had the opportunity to participate in the Parent Family Coalition fall meeting that brought together some, you know, a lot of folks, agencies as well as parents, to talk about employment. Again, I was still in that transition stage, and I was like, well, this won't work for him, you know, argued that to that point, and I thought, well, how does this all work? How do you do it? And from that point, moved into starting to participate in these calls, community of practice calls, and I'm really excited to hear David say that they're going to continue, because it was a huge part of my transformation as well as Kyle's. It was very helpful to find out that other folks were doing this and how we could go about doing this, and we used a lot of the tools that we learned there as well. So we started looking at job development. I put a call into vocational rehab, the local office here, and I kind of think I blew them away a little bit, because they called me in January of 2014 and we're trying to figure out where it came from, the application, and I said, well, you know, he qualifies, so let's start looking at it. So, you know, we started putting together a team, which included his Medicaid case manager, who's been very instrumental in helping us do this. I hope we don't lose him, but I'm worried with the managed care issue that we may. Iowa Voc Rehab Services were great with this. The local office kind of took control of it after a while. It took a little bit to get everybody up to speed, but once we did, and we got a great counselor named, and we started putting things together, as well as the agency that provides community supports for Kyle. Not that they were going to be directly involved, but they would informally be involved in terms of getting Kyle to work possibly at some points. So it truly was a team effort. In the summer of 2014, we kept going with the paperwork and getting all the ducks in order here, and a friend of Kyle's who manages the local Papa John's connected with us through my daughter, actually, who he knew, and wanted to know what Kyle was doing these days, and that he wanted to give him a job. So the offer came out of nowhere, but also I think it came in the way that many of us have gotten employment, through somebody we know. We build those community connections, and that's truly what happened here. So I kind of credit Kyle with finding his own job. Unfortunately, the system wasn't quite ready to go with it yet. We didn't have the supports in place, but Kyle's boss at Papa John's was very patient and was willing to wait until we had all that stuff in place. That's a little bit of a criticism to the system, because it doesn't move as fast as people do sometimes. And I think most of us, when we get a job offer, we want to jump in, and I think the employer wants that as well. They want an employee now, not in 3 months. So, and then moving forward, he did start work in October, and things were in place. It's gone well. So October of 2014, he started working. The next slide here is actually, it talks about building the power of relationships. Initially, Kyle's employer kind of just hired him and didn't tell some of the higher-ups about it. Said he'd apologize later, and I said, well, you're speaking my language, because I think sometimes we just have to go with things. One day, the district vice president who lives in Dubuque happened to stop by while Kyle was working, and kind of figured the whole thing. So the cat was basically out of the bag. But he embraced it, and that's him in the upper right-hand corner. And then about 2 months ago, the woman on the bottom left-hand corner came in, and that showed up on Facebook somewhere, and I'm like, now who's he meeting, and this happens to be the vice president's wife. So the looks on their faces, I think, says it all. Kyle certainly formed a relationship with them, and I'm hoping that's some job security for him for the future. The next slide, the man behind the pizza, and here's where this comes into play. One of Kyle's jobs at Papa John's is being the mascot, and he loves to do it. In fact, one of the things Brian, his boss, had shared with me is a lot of folks that work at Papa John's are high school kids, college kids. Well, they're a little bit too cool to put a pizza costume on, although I think you're kind of incognito, so I'm not sure I understand that. Now, Kyle was tailor-made for this because he loves to dance, so he gets out on that street corner and he brings in business, and from what I understand, the nights that he's been out there, business does seem to pick up, so I'm going to go ahead and credit him for that. So one of the things is, in cold weather, Kyle does have some issues with circulation, so one of the great things that happened through Voc Rehab was we were able to get some accommodations, and one of them was to get him a heated jacket, so when he's in the slice costume during cold weather, he's able to keep warm. So, and then we, watch when it's frigid, he doesn't do that, so he does other duties. One of those is making pizza boxes up, and he's very good at it. In fact, was able to participate in a competition a while back that the corporate folks do to, kind of promote the employee involvement, and it was a fun event for Kyle, and a lot of people were wondering how he did. Did he place? Did he this? And I just told everybody it wasn't so much about winning or losing, it was having the opportunity to participate. And for Kyle, that's what it meant for him. moving forward and learning new skills. We're not kind of just stuck in those areas. And one day Kyle went into work and his boss asked him, well, what would you like to do today? And he pointed over to the pizza making station and said he'd like to, give that a go. And Kyle's boss has opened all kinds of things and he let him do that. And I'm told that the one in the right-hand corner is his first skin, so that's a trade name for the pizza dough. And I didn't know that before, so actually have learned something new here. And that finished product was in the upper left-hand corner there, and that went to my daughters, I guess. So they said it was quite good. So I think he accomplished that. So I'm glad to know he's not in a standstill. The next slide here, we got a few upside down, but that's okay because it's as a parent, sometimes we're standing on our heads to get things done anyway. So I think the parents out there can probably relate to that. So this was the competition for the pizza games, and Kyle participated in making up pizza boxes. And as you can see a look on his face, he just loves to do it. This was Kyle's first paycheck back in October of 2014. He was extremely proud, and it was a paper check that we don't usually get no more, and so it was kind of fun. So we went off to the credit union to cash the check, and kind of a just off-the-cuff story that happened here was, it was a Friday afternoon, and we were in the car getting everything ready, and this young man came out of the bank, and he had construction clothes on. He was probably about Kyle's age, maybe even a little younger. And he took this little hop, and he had a big smile on his face. And I said, Kyle, I said, see, he just cashed his paycheck, and he's going to go out and have some fun, and he's happy. It's Friday. He's off work. And Kyle just looked at me and smiled. Well, the young man's truck was parked right next to us, and he walked up to the truck, and Kyle turns to him and flashes one of those famous smiles that he has at him and gives him a thumbs up, and the guy just gives him a thumbs up back. And I thought, that's real life, So went into the bank, and we did tell him that this was Kyle's first paycheck, and so he got a little high five from the teller and signed away and everything, and it is another learning moment for him, and it's part of real life. So I was glad we had the opportunity to do that. Continuing on, Kyle has learned how to advocate for himself, so we participated in Advocates for Change Day this last fall at the Capitol. That was leaving on the left side there, and give him a little thumbs up. He really enjoyed the day, and has gotten to know Senator Yoakum quite well, and so she's always loves to see him. And the right-hand photo was Kyle sending a message in to Representative Eisenhart to come out and visit for a while, which he did. And the next picture, we did the little photo op, and it was great. On the left, obviously, is Senator Yoakum, who took us into her office, and that was really a great opportunity for all of us. And the young lady is my daughter, Tara. And she's I often refer to as my right arm, because she'll take more risks with Kyle than I do sometimes, and I usually find out about things later, but I think all families kind of function that way sometimes. So nothing usually too dangerous, but it's kind of been helpful for me to open my eyes a little bit too, and kind of let go of the apron strings. So that's good. And as you can see, she was expecting a child. I have to put this in there. She gave birth to a baby boy last Friday. His name is Asher, so doing well. And so get that little plug in. I like to brag about my grandkids. And the photo on the left then is Representative Nancy Dunkel, who I just kind of know real well, and so we included her in our visit as well, and Representative Eisenhart, and then Kyle taking the main chair there, and he got pretty comfortable, so you might want to watch out, Representative Heaton. He might be coming your way. So that's my presentation, and again, thanks, Ashley, for putting this together. Another thing that I'll just like to point out a little bit is that some of the natural supports that we've put into place too in Kyle's job it's located in a little strip mall, and all the employers kind of know each other, and so Brian kind of instituted the folks in the other businesses to kind of keep an eye out for Kyle as he's out there doing Mr. Slice, and that's worked out really well. And so it's nice to have those natural supports. It's not always about, buying items and things that we need, although they're great to know that we have those resources there. But sometimes the natural supports are the best, and also truly what they are, and are natural, and it really has happened that way. So it's been a great experience. My next step might be that Brian has informed me that he may be leaving in March, so I think it makes it more important that that we've built those ongoing relationships with the higher-ups at Papa John's, so that will be a little more job security for him. So thank you for the opportunity to do this. It's been a real exciting journey here, and I have to say that Kyle might have been even more ready than me. I might have been holding him back a little bit, but we're really looking forward to increasing his hours at work and making more money and possibly getting on their health plan. That was even brought up to me, that at some point, if he gets enough hours, then we could certainly take a look at that. So he's earning his own way. Thank you very much.
Bill, thank you so much for sharing your family's journey. This is a great way to kind of segue into our topics today, because you touched on so many topics and issues that we've been working on for the last couple of years, and I think your involvement and effort has really made a difference. I know that you talked about the importance of community learning moments and real-life activities and real shopping, and the fact that as a family member, it's tough to sometimes feel like you're getting worn out, and the importance of having service professionals recognizing that. I thought the opportunities to see something more, and the whole idea of high expectations, and certainly you hit home on the importance of partnerships and community connections, and I think it's our goal to make sure that we're developing a system that is responsive and accountable and efficient, and you touch base on all of those things. I think one of the key comments that you made that I really appreciated was that after Kyle made the pizza, the daughters actually ate the pizza. So having that be what a great deal to see the kids eating the pizza that's fixed and that they didn't turn their nose up. So that, I think Kyle's heading in the right direction. So thank you so much for sharing the information.
You're welcome.
Yep, you bet. We're going to switch over now and hear a little bit from David Van Ningen. And David's going to talk a little bit about the work that Hope Haven's doing with their regional partners and the support that their region has in building appropriate employment support. So David, thank you for joining us, and we'll turn it over to you.
Thank you, David. Can you hear me all right?
Yes, we can. Thank you.
Great. If not, please let me know. It's really a pleasure to share this information with you today. Hope Haven has had the opportunity to benefit from ICIE and IVRS and AFC and DHS in our significantly stepping up activities related to community employment and transition from facility-based services. We've also historically had excellent support from the local counties here, especially Sioux and Lyon counties. Long before there was an emphasis on competitive employment, they were key to our being able to offer those kind of options and alternatives for people with disabilities that we serve. So when regionalization began to come into play, quite honestly, we were a little nervous. We had a good thing going, and we're not overly anxious to have to spread that activity and accountability over a broader base. It has, however, worked out much differently and in many ways much better than it had previously. Sioux Rivers Mental Health Disability Services region is comprised of 3 counties: Woodbury, which is Sioux City; Plymouth County, which is primary Lamar; and Sioux County, which is a conglomerate of little Dutch training center. from Lamar's, New Perspectives, Mid-Steps, and Great Plains, Goodwill, out of Sioux City and Hope Haven. Historically, those facilities, those organizations have provided traditional work activity, some supported employment, and to various degrees competitive employment services and supports. We have, as was the case prior to regionalization, had an excellent partnership with the counties in the area, with IVRS, with DHS, IME, through HCBS services, ICIE, certainly with our consumers, a lot of employers, and especially small businesses in the area, and schools. When we began meeting as a region, when the region was actually just in its formative days, those of us involved in employment services, including what were then known as CPCs, began talking about how we could work across the region to improve employment outcomes for people. And we came up with some basic principles that actually precluded the grant that we're currently working on collectively. They included our commitment across the region to providing employment choice for persons with disability, including the full inclusions of persons with disabilities in workforces of the communities within our region. That employment in the general workforce is the preferred outcome for all persons, regardless of the level of disabilities. This might sound a little bit like employment first language. How about that, huh? The region is further committed to ensuring that all eligible persons with disabilities who want to be employed will have that opportunity, including those currently served in facility-based services. And as a result, the region has now approved a multi-year project to improve outcomes for persons with disabilities living within the region. Our premise, and in some ways our promise, is that transformation from facility to community-based employment services is more than just a shift in settings. This generates a lot of conversation amongst the providers and with the county personnel, certainly the regional board, that we really want to view this transformation from facility to community employment services as something that goes beyond just the regulatory sources. It goes beyond just providers, that it really is even more than a change for the people we support and for their families. But as importantly, it's a community change. It's a change in how communities interact and support our neighbors, some of whom have disabilities. One of the values that becomes very apparent when you live in a small town is everyone is your neighbor. Sometimes that's a good thing. Sometimes it's not if that neighbor happens to go to your church and their dog barks a lot. But the fact is that we're in it together. And so as a region, our approach has been one that really talks about capacity. Talks about capacity by the local government, in this case the region, shifting priorities from facility to community services, and backing that up with resources. It's the capacity to empower consumers and clients and their families and their friends and the support system and their neighbors. Just prior to this meeting, I was meeting with some parents. We're trying to help them understand other changes that are occurring in the system, and they're integral part in helping their communities and their neighbors understand those changes, but how those changes create new opportunity for their adult children. Capacity to impact communities with and within those communities, resetting expectations that we really have instilled. People used to think of Hope Haven as a place where people went for services. Now we're hoping they see Hope Haven and the other providers in the region as a place where you go to further the goals in your life. And finally, a capacity through providers to extend existing skills and build new technologies. We have developed several outcomes for the project. Under regional capacity, again, our focus is on those 4 areas. Number 1 is to use evidence-based strategies and service models to support persons with disabilities seeking employment. Certainly person-centered planning and customized employment are that, but across the 5 providers, we don't all serve the same group or population of people. Some are more invested in supporting people with intellectual disabilities, others persons with chronic mental illness, and so we want to be able to bring programs and services into play that are specific to that population of persons with mental illness as well. And we've selected individual placement services, known as IPS, as that evidence-based model. Number 2, to develop outcome measures, including fidelity measures to ensure positive outcomes for people, and to increase access to quality employment services throughout the region. And number 3, really critical, to continue to develop partnerships with area schools, with mental health providers, community support providers, certainly with IVRS as a critical partner, and others in order to maximize choice for employment outcomes. Into the area of client consumer capacity, to create opportunities for persons currently served in facility-based services and their families, to help them understand the shift and the opportunities that come from a shift that has had focused on facility-based services to one that is focused on community-based employment. And importantly, the region will provide benefits education and planning to persons seeking employment to support their informed choice regarding employment options, consequences of employment on benefits, and other public assistance. Outcomes under community capacity, to develop partnerships with area businesses and industry, to increase opportunities for people with disabilities for employment, and to provide access to a reliable workforce for our area businesses. Number 2, develop partnerships with schools to support students with disabilities and transition. And number 3, to develop partnerships and collaborations with community resources to promote access to employment. Obviously, some of the barriers that are there aren't new. We have to continue to address them. That includes transportation, working with community living service providers, and a host of other things. And finally, the 4th area, provider capacity. Providers will obtain the competencies and resources necessary to implement evidence-based practices such as career exploration, job development, placement, retention, follow-up. The region will support providers to obtain training and implement skills in evidence-based practice. That includes funding of staff, training, consultation, mentoring, professional association membership, and credentialing. And number 3, a primary focus of regional support is to assist again in the transition from facility. Initially, for each of those 4 areas, we did an outline, a very basic outline for action plans for each of those 4 areas. Committee that includes each of the providers. It includes staff from the region and others such as IVRS and DHS. The region has approved 1-year funding for the first year of this project, $520,000. Folks, I think that speaks volumes for the commitment of our public officials in these 3 counties to recognize the skills and talents and the contributions of people with disabilities make. Funding for years 2 and 3 have been tentatively approved. Year 1 includes consultation, on and off-site training, conference attendance, and provider resource development, in other words, staff. ICIE has agreed to partner with the region for the project. We're really excited about that, especially in the areas of training and transformation. 5 years have committed to supporting up to 200 people in obtaining employment. It's been a busy time getting the project up and running. We really just began actively with the project July 1st, although planning did take place prior to that start. To date, each provider submitted an implementation plan. Each provider agreed to assign staff member to participate in the Employment Alternatives Committee of the region, to assign staff members to participate in project-related training. Back to my notes. Hang on just a minute. And to agree to targeted employment outcomes and provide required outcome data. We've agreed on a matrix of outcomes that we're going to track. and to provide a budget for the funds made available to the region and an accounting for those. To date, there's been a lot going on. As I mentioned, it's been really exciting. Each provider has joined ICIE and will be attending the conference next week. I think my last unofficial count is between the 5 providers. We should have about 15 people from this region attending the ICIE conference. Part, not all, of that expense is being covered by the region, as is the membership of each organization in ICIE. Collectively, the providers will be hiring or assigning 15 staff positions to the project, which again I think is indicative of the effort that all are willing to put towards this transformation. As I mentioned, outcome measures have been identified, including matrix and a format to track those. And our next major step, we need to spend about a whole day working on this, is we're going to take and flesh out those action plans a little bit more completely, with our priority being on provider capacity and staff training. The other thing that's not in the presentation that we've begun to do is have conversation about this project with other regions that are adjacent to the Sioux Rivers region, talking about how we might cooperate with activities that they have in employment and that they're looking at, and that cooperation would include sharing resources for staff training, possibly public education, and other areas. That's what we have to share for the day.
David, thank you so much. I know Sue Ann Morrow is giving you a thumbs up for the ICIE plug. So that conference is coming up next week, and I know it has a dynamic schedule, and we're really looking forward to that. And we also have a couple of our subject matter experts from ODEP will be available and doing some things with providers in a generic session and some individual things. So, Hope Haven, through you, David, and your staff have really been passionate leaders in the rehabilitation effort, and I know you found some excellent opportunities to work through some of this change and develop some of those creative and innovative partnerships with the region, which are very exciting. So we'll look forward to hearing your work and being able to share that so we can incorporate some of those strategies to help move employment forward. So thank you for sharing some of those comments.
Very welcome.
With that, I'm going to transition over to Shannon Jamison. Shannon, again, is the program director with Goodwill of the Heartland in Cedar Rapids, and that program has been participating with the Iowa Coalition of Integrated Employment's Leadership Series. And Shannon is going to share a little bit about what they're learning and implementing from the Leadership Series and how that's helped them build a healthy and sustainable community employment services team. So Shannon, thank you, and we'll turn it over to you.
Okay, great. Thank you, David. Can you hear me okay?
Yes, we can.
Okay, wonderful. Okay, as David said, I am with Goodwill of the Heartland, and I'm actually located in Cedar Rapids, so I cover our north region. For those of you that may not be familiar with Goodwill, we do cover 19 counties. So our larger areas include Cedar Rapids, Iowa City, and the Quad Cities area. So today, as I talk, I'm going to be talking about our whole organization and our transformation efforts. As David indicated, we did choose to participate in the Integrated Employment Leadership Series. So to date, we've had one session, and that was back in April. And actually, our second session is coming up tomorrow. So we're excited to go back for a couple days and learn more. But this series has really been beneficial for us, as we have started a transformation process in moving folks out of our sheltered employment and pre-vocational training into the community. So the timing of this leadership conference has been really good to help us, get some more ideas on how to make this transformation go as smoothly as possible. So back to the session in April, it was great to be there to network with others in the field and just to learn, what other organizations are doing throughout the state of Iowa. We sent some staff out to visit Candeo in Des Moines just to see, their transformation efforts and learn about their staff structure and so forth. So we've gained some really good ideas from some of the individuals that we met at that conference.
Another thing that we implemented from the April conference was to really look at our recruitment efforts for our supported employment job coaches. We've been finding it's hard to find part-time job coaches. So we had some good information on ways to change our advertisement to really make it more positive, community-based in our recruitment efforts there. We are also looking at kind of revising our interview process. We haven't gotten there yet, but we did learn some things from the conference that we do plan to implement just as we're interviewing coaches, and revising our questions during that interview process, as well as taking them out in the field a little bit as we look at prospective candidates. Another big takeaway that we had from the first session was really to look at celebrating our successes more. We've had some great luck with job placement efforts, and just looking to celebrate that more and get our staff excited as we get those placements. Another goal was to add a customized job placement specialist. That was a big conversation in the first session, and that was something that we have done now both in our Iowa City Goodwill location and here in Cedar Rapids. So here in Cedar Rapids, we're just kind of getting that position off the ground, but that person will work with those individuals with more significant barriers as we're going out and creating job opportunities for them. So really all of these ideas are helping shape our transformation process and what we're doing. We started our transformation process back in March of 2014, and at that time we identified about 354 individuals that were in pre-vocational training, and set the goal to try to move 280 of those individuals out into other services, and that could include community, competitive employment, rehabilitation, and other services that were of choice for that individual. We also made the decision back in March to eliminate the use of the labor certificate. So we are transitioning out from using that certificate. So that will end in 2016. We also made the decision back in March of 2014 to eliminate all sheltered work services at the end of this year. And of course, with doing all that, our goal was to increase our job development services and activities. So to date, we have placed 116 of those 354 individuals into competitive employment. We've also moved 90 individuals into other services. We've had some that have chosen to retire, and others that have moved into other programs, such as a rehabilitation program, that just decided that they weren't wanting to move on to competitive employment. We've also been adjusting our staffing model to accommodate all the growth that we're seeing with our job development services, and we've done this throughout our organization. So really focusing our staff more on specializing. Now we have staff that are just supporting individuals, in the community as they obtain employment. We have folks that are just doing placement activities, so just out there doing job placement services to individuals. So we've really tried to make more specialized positions as we're going through this transformation process. And then, of course, as I mentioned a little bit ago, our customized job placement specialist, again, who's working with those individuals with more significant barriers and really giving more time to the discovery process, job shadows, and so forth. Just to give you an idea of our organization as a whole, through July of this year, we've had 470 competitive placements. So, along with those 116 individuals that we've moved out of our workshops, out of our pre-vocational training, we've had a lot of other placements as well from our other services. So we're really excited, in the direction that our competitive placements are moving. Goodwill as an organization has also been committed to hiring individuals, and 56 of those 470 people have been placed in one of our Goodwill locations, and that's about 15% of our placements. That might be a retail associate at one of our Goodwill stores. It might be a custodian. We've opened some custodian positions throughout our different buildings, as well as some positions in our manufacturing center. So we are very committed, to, as we move individuals into competitive employment, really looking at our organization and creating opportunities as well for new positions for folks. And just to give you an idea of this transformation, our organization traditionally has been very heavy, on the pre-vocational sheltered training. We were serving 683 individuals back in 2013 in these services, and we're down to 349. So we're really making that shift to community-based services. And I just thought I would throw in a few, new decisions that have just happened in this last month that we're excited, again, to go back to the leadership conference tomorrow to get some new ideas here, because we have made the decision now to end all of our pre-vocational services by March 15th of 2016. We had considered keeping pre-vocational training going in our Goodwill stores, as we did feel they were an integrated competitive environment. But due to some recent proposed changes from DHS in looking at changing pre-vocational services now to an hourly rate, we have made the decision that as of March of next year, we will no longer be training. So we're going to be, moving folks into competitive employment. We also, along with that, we've already, increased our hiring efforts here at Goodwill, but we will also be doing that more. Our stores will be committed to hiring 10% of their labor hours, and they're going to dedicate those to supported employment clients. So this will be in addition to the people they've already hired. In a store, we'll have about 50 to 70 labor hours per week that will be devoted to supported employment clients. So we're going to be carving out positions, with the goal of hiring 5 to 7 folks at each of our stores. We are also looking to implement a new retail certificate training program, and that would be a program that Goodwill would fund, that we would look to have under the National Retail Federation certification program. We do plan to continue pre-vocational under the new proposed career exploration that would be time limited and more of a one-on-one service that's really looking at more discovery type activities and person-centered planning prior to those job placement, placing the person. As well as then looking to expand our community services and doing more occupational skills training programs. We already have about 4 programs going here in the Cedar Rapids area, so really looking again to do more community-based programs for individuals as they look to move out into the community. So those, like I say, are fairly new decisions that have all just come up here in this last month. So as we go back to the leadership conference tomorrow, we're really going to be talking about, staff recruitment, developing staff, and building that culture, because as everyone knows, it's been a big shift from what we've been doing. So we're really looking to gain new ideas this week on how to build strong teams and get everyone on board with all the changes and everything that we're doing. So that concludes my presentation. So be happy to answer any questions.
Shannon, thank you very much. I need to make sure I recognize Amy Dessenberg-Wines and Jessica Creo and Ashley Lance for the work they're doing with the Iowa Coalition. And they were able to, over the last several years, leverage resources with Employment First, and it's really helped us continue to have these conversations. I was struck, Shannon, by your comments. One of the statements that I had received about the leadership series was that they were targeting programs and people who had the desire, passion, and potential to build high-performing, integrated, competitive employment services. And from your report, it's very easy to see high expectations and ambitious goals, and not only what's exciting about the goals or the outcomes and the opportunities you've had to share some results. So thank you very much for sharing some of that information with us. I'm going to kind of conclude today by turning it over to Representative Heaton. Sue Ann had shared with me that Representative Heaton will be getting some additional recognition at the ICIE conference. Well, he'll actually be presented an award. So for those of you that can join us next week, you may have a chance to meet and greet Representative Heaton. Representative Heaton, I think you can tell that there's a lot of activities occurring across the state in employment, and of course we still have a lot more to do, but as we look at some of the changes that have occurred over the last several years and the changes occurring in our culture, a lot of that is due to the work you and your colleagues are doing and the support you've provided behind the scenes to create a foundation to allow systems to do the best that we can do. So thank you so much for your work, and I know you're going to be getting ready for another legislative session this year. I don't know if you have any particular comments or feedback that you'd like to share our audience today, but we really appreciate you joining us today, and I'll maybe let you make a final comment for us.
Well, first of all, I'd like to acknowledge Bill Stumpf and his presentation and his son Kyle, which was an excellent example of how a child with disabilities can become involved in the workplace, and someday, you know, he'll be self-sufficient perhaps and be able to live on his own and in a community and enjoy life as any other individual that is without disabilities. It's a great story, Bill, and thank you for your presentation.
Thank you very much, Representative. I really appreciate that.
I always like to acknowledge David and his work up in northern Iowa. I'll never forget when I was walking through the system trying to learn all about human services and what they do, and was visiting his facility up in northern Iowa, and I walked into his manufacturing facility and saw a fully integrated plant where people with disabilities were working next to a normal employee, and he turned to me and he said, "These people are making good wages, Dave, and not only that, they have their health insurance. This is the ideal of what it's like to have a person integrated into the workplace." I remember when I went to Washington, D.C. to a disability conference, and I stood up and spoke up about what I'd seen, and I got booed. The unions don't like these kind of things. They don't like people with disabilities necessarily taking the jobs of who they consider, they just don't. They didn't like it. I don't know whether they still do or not, but I always like to tell that story. But anyway, what I want to say is I recognize the difficulty financially to move forward with integrated work, supported work. These people that you have to hire to help our people adjust to the workplace don't come cheaply and are difficult to find. And so I remember visiting a facility in Waterloo, an agency up there, who told me that, Dave, you know, integrated work's all well and good, but we're losing $40,000 a year in pushing for integrated work, and it's a losing proposition. I have to go to the community and ask for contributions every year just to support my efforts in supported work, and I never forgot that. And I made some friends with David Mitchell and began to work with him and the Department of Human Services, and we came up with an appropriation this last year that was a 6-month appropriation that was to begin January 1st, 2016, and we funded that with $750,000 of state money. Of course, with a Medicaid match, that's a significant amount of money, a little bit over $1.5 million to provide for integrated work. Things didn't happen the way we wanted them to. For some reason, there was no language in the budget bill. The money was there, but we forgot to put the language in the bill for a 20% increase for supported employment. And so our plan is that we will, at the beginning of session in January, pass this legislation to the House and Senate and send it to the governor's desk, making it retroactive, and be able to get our new financing program in place. I apologize profusely to those providers out there that are listening today, but we're going to do the very best that we can to get this all straightened out. So good news, and I hope to be able to get things accomplished this next year. The best of luck to all of you out there, and hope to see some of you this fall before we go back to work in January.
Representative Heaton, thank you so much, and that's a great way for us to conclude our Community of Practice call today, knowing that we still have work to do, but celebrating the work that's occurring out there. So thank you, everybody, for your leadership. Make sure before you sign off that you take a minute to complete the satisfaction surveys on the computer and sign in with your name and location. We can track that, and we report that to the Office of Disability Employment Policy. And also make sure to identify topics that you think would be beneficial for you as we look at next year's Community of Practice calls. With that, everybody have a great afternoon. Thank you for the work that's occurring out there. Goodbye. To identify topics that you would look at next year's Community of Practice.